Hi everyone, my name is Ashling Melton. I have been a nurse for almost 16 years. I currently work as a RN clinical coordinator for a colorectal surgery practice here at Akron City Hospital, which is a part of Summa Health System. I started my education at Kent State University. I was going for a major in human and family development and a minor in psychology. When I realized that really nursing was kind of the best fit for me. So I did transfer to the University of Akron and I graduated with my BSN in 2010. Over the years, I've had the privilege of working in a multidisciplinary surgical practice that has evolved into a colorectal subspecialty, where I coordinate care for patients with both benign and malignant disease, including colorectal cancer. And a large part of my role really does involve educating patients, helping them to better understand kind of the why are we doing this, what they can expect, providing anticipatory guidance with respect to things like this. And so a good example of explaining labs or diagnostic imaging to a patient will be, say, like a newly diagnosed rectal cancer patient. We'll order labs on this patient. I can explain to them why we're ordering the labs, what we're assessing for, specifically a CEA level, reviewing with them that not all tumors express this, it's non-specific, but going into the explanation as to why we get it, why we get this up front as a baseline number, and why we would continue to follow this. In addition to that, they would also have CT scan, chest, abdomen, and pelvis with contrast to assess for distance spread, as well as a pelvic MRI, which really does locally stage the tumor so that we can assess whether or not the patient would benefit from neoadjuvant treatment prior to any kind of surgical intervention. After completing my master's program, I do plan to return to my current surgical practice as an advanced practice provider. And I really do look forward to expanding my role as, independently, treating and managing patients. However, one challenge that I do anticipate is transitioning to my new role in a very familiar environment. So I've worked in this same practice for 23 years. I have worked in a variety of roles, but again, almost 16 of those years as an RN clinical coordinator. And so that will just kind of be a strange transition, but one that I'm very much looking forward to. So I look forward to learning alongside all of you. And it's just so exciting that we're taking this next step in our careers. Good luck to everyone.